Hello and welcome back you all to the Crisp TV. I am your host. Today is 11th October 2025. We had a fantastic first day yesterday at the Crisp Conference 2025. And my name is Dr. Abad Khan. I am an interventional cardiologist currently practicing at St. Joseph Hospital, Ghaziabad. So now today our first guest, we have an extremely renowned interventional cardiologist with us here tonight on Crisp TV, Padma Shri and Padma Bhushan Dr. A.B. Mehta sir. Sir, welcome to the Crisp TV sir.
My pleasure.
And he is a name that does not need any introduction of any sort. And without wasting much of your time, sir, we'll have a few questions and we'd like to have a few answers from you, sir. Sir, this is the second consecutive year
Yes.
I have been fortunate enough to talk to you and have gained wisdom from you. Thank you for doing this, first of all. And sir, since you have been here seeing interventional cardiology field from the dawn of the time in India, so what have changed? What changes have you witnessed vis-a-vis in the rapidity of technology, advancement in the field, and the rapidity of acquisition of skill, knowledge, also the age at which the younger generations are able to perform these highly complex bifurcations, left-hand bifurcations. What do you feel about it, sir?
It's very exciting. Very exciting. I never anticipated that the progress would be so fast. Tremendous growth in the field of interventional cardiology amazes me. And what a skill, what knowledge, what intellectual approach the younger generation is possessing. I, I, I'm, 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 I never would have imagined that they would be so smart and so, I would say, they're excellent in picking up the techniques. They're innovative, they are thinkers, and they will take the interventional field at a different height. I'm so amazed at their performances.
Sir feels extremely proud and extremely hopeful of the new generation of cardiologists and what the new cardiologists are able to have their thought processes by themselves. Sir, also now with the new generation of tools, advancements in the coronary work, with the new generation of IVL coming and the new generation of sort of dual imaging coming up, literally mushrooming with so many of the tech advancements and in the field with all the medical devices company. The same is going for the structural also, heart interventions. Do you feel somewhere the preventive cardiology is not developing at the same pace as an interventional cardiology is developing?
Preventive cardiology has been totally neglected because you see, treating people is a thrill. Doing procedure earns more income. At the same time, it gives you a sense of adventure. And that, I think, has put the preventive cardiology at the back seat. And I think we ought to do a lot of work in prevention. For example, when we see that the people at the age of 30, 40 are developing heart attacks when they are at zenith of their career, that I think is extremely painful. It's devastating to the family if they lose any member of their family at such a young age, and I think it is very, very painful. And prevention starts from the age of 20. When I was investigating in Chicago, the school-going boys and girls, I found 16% of the boys and girls had a high cholesterol. So therefore, I think the prevention has to be emphasized on everybody's mind very, very emphatically. Yeah.
How do you see, sir, this part of preventive cardiology can be done vis-a-vis the focus remains for the new generation, especially also the older generation. The focus has remained interventional cardio. How do we change these things up, sir?
So they both have their own places. Uh, Prevention is, that nobody is infinite, we all are finite. But if the terminal events happen at an appropriate time, then there is no remorse, no regret. But premature events are definitely a matter of concern, a major concern. And I think if, despite the best efforts at prevention, you can't be 100% successful. So those who have, despite prevention, developed disease, obviously you've got to treat them and treat them as efficiently as you can and give the minimum discomfort with the maximum benefits. That would be continuous aim, and that would continue to stay. And that's how interventional cardiology has succeeded in preventing thoracotomy. Vast majority of the patients can get away without doing surgery, and time will come that this surgery might be required for very, very few cases. That I think, so the growth of preventive cardiology and interventional cardiology both should be pari passu, simultaneous.
Perfectly put, sir. One advancement in one of the technologies does not have to rely on the, does not have to be competing with other technology. Both have to advance at the same time. This is the message the sir wants to give. Also, sir, now with the availability of drug-coated balloons, and it's been hot topic over the past 1 year in all the conferences, and your forte has been bifurcation angioplasty and CTO PCI. How do you feel that the drug-coated balloons, will it be practice changing, or it will just be another synchronous device to a drug-eluting stent?
Let's take them separately. First, we talk about bifurcation. You know, the bifurcation techniques, as we practice here, when both branches are involved and rendering major ischemia, there the drug-coated balloon has a tremendous contribution because it will simplify the whole procedure. You will be getting away either with the two drug balloons or main branch stenting and the side branch drug balloon. And all different techniques, complex techniques like decay crush, mini crush, QLOT, etc., will not be needed anymore. So that I think, just in case in time to come, we find that the drug-eluting balloon is capable of producing identical results or better, I think it will be a great day. Now talking about CTO. CTO still requires, if in CTO, if there is a wire success, you are assured of 95% procedural success. Now that of course will continue to require skill, experience and dedication. But in that, the drug balloon of course would be after the lesion preparation in CTO, where the lesion preparation in CTO is not the same as it's in ordinary non-CTO cases. So therefore there the need for a technique skill will continue to stay till such time when we find forward-looking IOCs or forward-looking imaging system, then I think it will be simplified. But those days are not very far. Not only that, but Abad, I want to tell you one thing more. A day will come that you sitting here in your own hospital be able to offer treatment to a patient who is very remote place. Like for example, from your city, you may be able to offer a treatment to somebody in Sri Lanka or somebody in Kanyakumari or anywhere
Wow.
by
So,
robotic techniques.
wow, this is something only a person who is as visionary as Dr. A.B. Mehta sir is can provide a foresight and into the future, because he himself has seen technology developing so rapidly. And sir is all praises for drug-coated balloon technology as of now for at least bifurcation PCI, and hopefully we are also are in the same vein, I think. Sir, you have been here last year also. How do you think that the CRISP conference 2025 has evolved, and currently what are its strengths?
Why are we at all having conferences? The number one, every 26 seconds, one article is published. 30,000 magazines are published per year. Therefore, it is impossible to be able to keep up the state of art knowledge. Impossible. So therefore, this ready-made concoction or ready-made, I should say, the dose or a shot given to me helps me a lot for me to keep up to date. And CRISP is doing a marvelous job. There is no question, no biases. My frank opinion, CRISP is one thing which is keeping in mind the practical aspects of the interventional cardiology.
Thank you so much, sir. He is loving the CRISP conference 2025, and I hope next year also, when we become as good we are, and maybe even better, he'll come and have a few words again with us. Thank you on CRISP TV, and thank you, AB Mehta sir.
Thank you, Ahmed.
Thank you, sir.